suicide, dignity care with death, medical aid in dying, and physician-assisted death. These are all the same infamous titles. Death, for anybody, is the most vulnerable experience that you can go through. Prolonging the life of someone in this terminal state is inhumane and very cruel. In suffering, there's no dignity in dying, as somebody goes through dependence, loss of control of their body. It's our job to comfort our loved ones into death. Legalizing assisted suicide, physician-assisted suicide, is something that is the future for us. Many states have already started this practice, as well as other countries. Medical and ethical standards will be held in conducting assisted suicide, and here's how we should do it. So, what illnesses would qualify for physician-assisted suicide? So, terminal cancers or cancers that are reoccurring and uncurable. That would include things like breast cancer, myeloma, lymphoma, and other terminal forms of cancer that will not go away. Other neurodegenerative diseases such as ALS and Parkinson's would be qualifying diseases as the person slowly starts to lose control of their nervous system. Other muscular degenerative diseases would also qualify, such as muscular dystrophy and congestive heart failure. Other autoimmune diseases such as lupus, as well as AIDS, and other autoimmune diseases would also qualify, as these ultimately lead to death. I also would like to include major critical accidents, as sometimes there are injuries that are not fixable and the person may not recover from. So why should we support dying in dignity at the end of life? So, like I said, a lot of people are suffering as they're getting towards the end of their life. This can come with things such as terminal pain, all the way from the start of their decline to the end of their decline. There's only so much that we can do to make our loved ones comfortable, and ending their suffering early at their terms is the best possible solution. Also, in prolonged decline, patients can face things such as withering away and needing round-the-clock care. So this puts a strain on not only the patient mentally, but on the families and the caregivers mentally and physically over long periods of time. We have to have compassion for these patients because they are not just patients. They are our families, our friends, our mothers and fathers, aunts, uncles, and our grandparents. We do not let animals such as dogs and cats suffer in the shelter, or if you hit a deer on the side of the road, we would humanely put them down. So why do we not do the same with our terminally ill or in pain family members? In doing so, we should make ethical laws and precautions in place so that physician-assisted suicide is not weaponized. These ethical laws would prevent things such as unsafe suicides or unethical murders of our loved ones. Someone who is dying and is in a lot of pain would usually take any measure to end their life and end their suffering. If you saw your loved one in the same state, I'm sure you would want to end their suffering as quickly as possible. So, physician-assisted suicide is not murder. It is not a sinister practice. It is a way for us to honor life and to preserve the dignity of our loved ones. Patients facing these challenges may incur many things at the end of their life, and we should do our best to preserve what they have left. Giving them safe and ethical options is the least that we can do, and it's in their best interest and in our best form of care. Thank you. And this is my audience.